So as you look at this diagram, while we start discussing it, you see where the patient is. So with respect to the x-axis, what are you thinking of first? An acidosis or an alkalosis? Ala, good morning to you. And yes, you're thinking acidosis because you are below 7.4. And of course, if you were above 7.4, you would be in an alkalosis type of state. But then the big issue becomes, is it metabolic? Is it respiratory? Is it a combined disorder? That's what we're going to have to try and figure out right here. But we know it's an acidosis. If I look at the PCO2 line of 40, I'm not on the PCO2 line of 40. And if I look at the bicarbonate, I'm around 24. So let's see, what do you think has happened to this patient? Anyone else wants to click? With 23 of us, some of us just arrived. Good morning to you. Shall I show you? All right. So first, no one wanted A. Let's see. When you take hallucinogens and now you have a panic attack, what do you expect as a primary disturbance from the panic attack? I agree, Sharon. Good morning to you. I agree. Respiratory alkalosis from hyperventilation. And respiratory alkalosis would obviously be on the right side of that diagram. So all this because of hyperventilation. I'm going to put hyper V dot, blowing out the CO2, hijack. And besides, you know, a classic side effect when you take too much hallucinogens is to do what? What do people often do when they take hallucinogenic drugs? That could also be a reason for alkalosis. Sometimes in certain religions around the planet, some people may do hallucinogen to purge themselves. So what can happen when you take too much hallucinogens? Vomit, L. Absolutely. So may also cause vomiting. And vomiting, that would be a reason for what, L? Or anyone else? Metabolic alkalosis, Sharon, absolutely. So one way or the other, I think we are persuaded that my answer A, there's no way it would have been where my patient is. If anything, it would have been on the exact other side. So I'm glad nobody took this one. Now, overdose of opiate, that's a different drug of abuse. Opiate and opiate receptors are found in the actual brainstem, in the medulla, where respiratory centers are. You remember mu receptors, they're GI coupled, and they're lower cyclic AMP, they're inhibitory, and they're inhibitory of respiration, respiratory centers. So there's going to be powerful CNS depression, in which case they should result in what finding? That should cause, with CNS depression, respiratory depression, Sharon, that would cause respiratory acidosis.